And welcome back to Dr. Noah's YouTube Health. And I have one of my favorite patients here. Virginia, introduce yourself and kind of tell us a little story about how you've met me and what I've done for you.
Well, it's probably a long story now.
That's okay. Well, we have a little time. We have a couple minutes to talk
Well,
about.
I'm Virginia Means, and I'm 83 years old.
No way. We just talked about you're 39. Okay, well, anyway.
Well, that's our story, isn't it? Anyway, I in the past had a long history of neck, upper neck, stiff neck, from tension sitting in an office for many
Sure.
years.
You work for, in terms of clerical work, right?
Yes, I did a lot of proofreading, kind of sitting in awkward positions,
Right.
and so I kept having this problem, and I would go to have a chiropractic adjustment, maybe whenever it started to flare
Yeah,
up.
bother you.
And then I found that was not working. So when I found that it was the best thing to do is to do this monthly.
We talked about prevention. God forbid prevention. For every dollar, this is from the University of Utah, a couple years ago, for every $1 spent on prevention, you save $16 in terms of crisis care and medicine and drugs.
Well, I found that when I waited, and
Yes.
it got so bad that I didn't even want anybody to touch
Yeah,
me,
right.
and it was really painful, and it started to be
Causes more
debilitating.
problems, right.
So then I found that if I came in every month to have an adjustment and a massage,
Nice.
that I don't know, I seem to be more settled.
You're better
My
because
health
you're
is-
preventing things until they escalate to where it becomes a real crisis.
And so
like
I don't
that.
have pain now to the way,
Right.
and I just, many of my friends.
So you do feel like you're 39 years old because we talk about it. At your age, most of your colleagues we've talked about, most of your friends and associates, they're in terrible places, right?
They're in terrible
They are.
terrible place because, and they're the ones who say, oh, I wouldn't go to a chiropractor. Oh, no.
Oh, no.
They're that generation.
Right.
And
they keep
I
taking the
said-
drugs, doing the surgery, and they keep falling apart. And you're a very vital woman. Should we just talk about all the different? You just went to a kind of a choral type of workshop
Yes, I'm
in
active.
Sacramento. Yeah, you're
I'm
active
still
with
active
your
in-
church and
right.
your friends and doing positive things.
In fact, I can't find enough time to do all things.
Exactly. That's
And
what-
I have the energy to do it if I just had enough time.
And that's nice.
And so I really feel that doing this on a regular basis is really the key to.
Plus, the good thing is you eat well, you take some natural supplements and stuff
I
that
do,
we do to
yes.
kind of keep your body healthy. And this is the proof that we see.
Yes, several years, well, about 3 or 4 years ago now, I had a bone spur in my
Right.
hip. Really became painful just kind
Right.
of overnight.
Right.
Well, I needed to have immediate care, so
Sure.
I went to my regular doctor and got
Right.
some painkillers that lasted me about 2 weeks. And,
Right.
and when I saw the side effects, it was a
Not
page
good.
and a half of horrors.
Well, those pain pills kill more people than AIDS does, so that's
Well,
not
so
a good
then
thing.
I came to Dr. Noah, and he put me on some alternative stuff
Natural
that it took
things?
about a month
Right.
to kick in,
Kick in
and the
and be
pain went
effective,
away, and I
now
haven't
you've
had,
been doing great otherwise.
I haven't had any trouble since.
That's great.
Literally. So I just feel that
You've been blessed.
I have been blessed.
Thanks. Well, thanks for Virginia, and you can check this out at another time.
Okay.
Thanks for watching.
I appreciate this.